Well, welcome um, to June's statewide meeting, and today Carly is going to be doing a Medicaid uh, s- talking about Medicaid today. So here's Carly.
Hey there, everybody. My name is Karly Sciortino-Poulter, and I'm the director of the ARC Advocacy Network at the ARC of Indiana. I know some of you, and it is wonderful to meet those of you who are new to me. Um, but Noah asked if I could come and talk to you guys about Medicaid, because the reality is, since the beginning of the year, there have been a lot of proposals on making changes to Medicaid. And so there have been a lot of rumors. There have been a lot of changes. There's been a lot of misinformation. And there's a lot of evolving information. And so Noah asked if I could come talk to you today
How's it going,
to
Pearl?
talk
How's it going?
to
Good.
talk about, what is really going on right now when it comes to Medicaid. And so I am happy to do that. I have to admit, I've got a few different presentations in the next couple of weeks on Medicaid. And when I set a lot of those up, I thought by June, everything will be settled down and we'll have a good idea of what's going on. Boy, was that optimistic. Um, because the reality is, things are still very much in flux and are still definitely changing. And so one of the big things is that I'm going to talk about Medicaid. And I can tell you this information was accurate as of 9 o'clock yesterday morning. I will tell you things have changed since I finalized this presentation. And they have, excuse me, they have changed recently enough that I have not been able to update the presentation. Um, I will share what I know. I will tell you the information to the best of my ability as of right now. And I want you guys to ask your questions, because everything right now is so confusing, and we're hearing so many different things, and depending on where you get your news, or what websites you frequent, you may be hearing completely different things. So I want to make sure you guys know what's going on. So please ask your questions at any time, okay? And so I'm going to start by sharing my screen. Okay. And are you all able to see the presentation? It says Medicaid Changes 2025. Perfect. I'm getting thumbs up here. I want to remind you, if you need closed captioning, you are welcome to enable that. We were trying to figure out a way to do that for everybody, and well, I'm not that good. So let's talk about the Medicaid changes that are going on. And let's start with Indiana Medicaid, because there are some important things to understand about Indiana Medicaid. And the first thing that's important to understand is that Medicaid is not just Medicaid. That's what I thought when I started this job, and I was wrong. Here in Indiana, we have 37 different types of Medicaid. And while there are some general overarching rules for all of that, every single one of those 37 types has their own exceptions and their own twists and turns. And to make it even more confusing, sometimes within each of those 37 categories, we have subcategories within that. So, for example, a lot of individuals with disabilities are on Medicaid disability, which is one of the 37 categories out there. Well, regular Medicaid disability has one set of rules. If you have Medicaid disability and are in an institutional setting like a group home or like a nursing facility, that's a different set of rules. And if you are on Medicaid disability and you have a waiver, that's a third set of rules. So that just kind of gives you an idea of what we're dealing with and why Medicaid gets so confusing. I will also say that here in Indiana, we have about 35,000 people on the developmental disability waiver. So either the family support waiver or the CIH waiver. We've got about 35,000 people on that. we have 2 million people on Medicaid. So we literally make up under 2% of what the Medicaid office does, and we break most of their rules in the process. So that's why it feels like it's hard to get a straight answer out of the Medicaid office, is because Medicaid is not just Medicaid. There are a lot of different exceptions to everything. And especially when it comes to income and asset limits, those all vary by the type of Medicaid you have. And so that's one of those really important things to understand when it comes to Indiana Medicaid. We also have some interesting things where um, people will sometimes say they have traditional Medicaid. I'll be honest, that makes the Office of Medicaid Policy and Planning cringe, because the way they use the term traditional and the way the rest of the world uses the term traditional are very, very different. And so one of the things is, here in Indiana, we can kind of break Medicaid into two different categories. We have managed care Medicaid, and then we have fee-for-service Medicaid. Managed care is where you have a company like Anthem or United Healthcare or Humana or MHS or CareSource. You have a company like that who manages certain types of Medicaid, and the state of Indiana pays those managed care entities. Sometimes you'll hear them called MCEs. They pay them a set amount of money to provide all of the medical care for one of their clients, one of their beneficiaries. And the way that managed care works is that, if um, you know, the company is getting a set amount of money from the state to provide for your medical care. If you use all of that money, hey, no problem. If you use more healthcare and you have more expenses than what the state gives that managed care entity to cover your costs, that means that managed care entity has to eat those costs. They lose money. But if, let's say, that you're regularly pretty healthy, you don't necessarily go to the doctor a lot, you don't have a lot of healthcare needs, and so the managed care company is getting a set amount of money to provide your healthcare, and you don't even come close to using it all, that managed care entity gets to keep that as profit. Okay, that's how managed care works. Fee for service is different, and people who are on waivers are supposed to be in fee for service Medicaid. It gets messed up a lot, but that's what they're supposed to be on. And that's where every single time you go to the doctor, or every single time you have a test run, or anything like that, every single service you get, they bill for that specific service. Okay. That is fee for service. And that's what people on waivers are supposed to be in. And then one of the other really important things to understand as we're about to talk about Medicaid and some of the things going on, one of the things you need to understand is that home and community-based services, that's the official name for Medicaid waivers, they are not entitlement programs, which means states do not have to provide home and community-based services. They don't have to provide waivers. States get to decide if they want to provide waivers and how much they want to spend on those waivers. And that's one of those really important things to know and understand. So now let's talk about some of the current challenges that we're facing. Well, first of all, in December of 2023, right after the state finished the first public comment period on redesigning the skilled nursing waivers and announcing a few amendments to the family support and CIH waivers, in December of 2023, the state announced that there was a nearly $1 billion projected shortfall in Medicaid. Basically, the state went over budget by almost $1 billion just on Medicaid. And that led to massive rewrites on the skilled nursing waivers that they were rewriting. That is what led to limits that the state is putting in place for ABA therapy, and it's caused the state to try to reduce the number of people who are actually on Medicaid. That was December of 2023. In April of 2025, It was during the General Assembly or during the legislative session when we were looking at all sorts of laws pertaining to Medicaid and pertaining to MedWorks and all sorts of different things. In April of 2025, the state announced that they were going to have a projected $2.4 billion revenue shortfall, meaning they were going to take in $2.4 billion less in taxes than they expected. Imagine if you're working and you normally work 15 hours a week, you kind of bank on that, that's what happens every time. And then suddenly your boss says, "Hey, I need you to stay home on Thursday uh because we can't make payroll. So I need you to stay home on Thursday." All of a sudden, your check is going to go down because you didn't work that day. Well, that's essentially what's going on here is the state was expecting to get a certain amount of money in tax revenue each year, and we just found out they are expecting that we will be $2.4 billion short on that. And so what that did, because the legislative session was still going on, when that information came out, that put a hold on certain projects. So one of the things they were looking at was expanding MedWorks, for example, and increasing the income guidelines and increasing the asset limits on MedWorks. That got put on hold for right now. One of the other things that happened is that with the budget that got passed, um, the General Assembly already cut every department by 5%. Their budget this year for the next 2 years is 5% less than it was, the year before. Well, what just happened a couple of weeks ago was Governor Braun has initiated another 5% budget cut. So now all state agencies are getting 10% less money. And so we're seeing that in a lot of different ways. So like they have laid off, people who work for state agencies. We're seeing hiring freezes. And so this change in Indiana's financial situation is having a big impact and is going to impact Medicaid. And then we are also facing the possibility of federal funding cuts because Medicaid is this unusual program where here in Indiana, approximately 2/3 of the money that pays for Medicaid comes from the federal government and 1/3 comes from the state government. So if we're going to have federal funding cuts, that's going to really have a huge impact on Medicaid. So now let's talk about what some of those current impacts are. The good news is in the legislative session that just finished, there were a lot of proposals that would have made cuts to Medicaid, and we were able to stop most of those. So, for example, there is a program called the Healthy Indiana Plan, or HIP, and that is what Indiana calls our Medicaid expansion. We've got a decent number of people with disabilities who are on HIP, and oftentimes it's because they can't get through the Social Security process. So they will go on HIP. We also have a lot of caregivers who are on HIP and a lot of DSPs who are on HIP. Well, when the session began, the legislature was looking at capping the number of people who were on HIP to no more than 500,000 people. That would have kicked 250,000 off. We were able to get that stopped. Okay, and so there now is no cap on HIP. They were also going to limit ABA therapy to no more than 36 months in a lifetime, but they were going to make it retroactive. So if you had ever had ABA therapy in your life, they were going to count that against that 36 months that you'd be eligible for. Well, while they still put that 36-month limit in place, it is no longer retroactive. It is just from April 1st on. And in reality, what that did was that buys us 3 more years to be able to educate the legislature and educate Medicaid in how ABA therapy is provided, so that we can try to change their mind on that limit. Um, Like I said, one of the other things they were considering was expanding MedWorks. Well, right now that's been put on pause. But they're not fully going away from it either. So they're this is something that's going to be studied over the summer to see if we can expand HIP, or excuse me, MedWorks coverage so that more people with disabilities are able to get on MedWorks and more people are able to work without putting their benefits in jeopardy. And then the final thing that I'm actually really proud of is that we were able to eliminate marriage penalties when for married couples who are both on waivers. Because typically with Medicaid, when you have a married, a single individual has a $2,000 asset limit, but a married couple has a $3,000 asset limit. While that's a little bit more, it's not the same as two separate single people would be. And so we got some legislation passed this year that if both uh, both married individuals are on waivers, instead of having that $3,000 couple limit, they're both going to be given the individual set limit of $2,000. So instead of being able to have $3,000 in assets, the couple will be able to have $4,000 in assets. That's, while that may sound like a small change, that's actually a really big change. But I'm really proud that we were able to eliminate that marriage penalty so that married couples aren't treated worse just for getting married.
Hey, Carly, I have a
Yep,
question.
sure.
Everything that you're talking about is
Uh-huh.
on a state level, right?
Correct. Correct.
Okay, so is this going to ever go onto a federal level? Because I know that there are some advocates that are
Right.
trying to fight this on a federal level. And I know like a lot of people have been fighting for this on a
Mhm.
state level.
Right.
And since we're so happy and proud to hear that, why hasn't there been anything announced about it, especially about the marriage penalty?
Well, and I think the reason people aren't hearing about it is simply because there's so much other Medicaid news that other Medicaid news is kind of drowning it out. Okay.
Okay.
Um, are there efforts at the federal level to change this? There absolutely are. Again, I think this is one of those times where um, there are so many things going on at the federal level and so
Mhm.
many really important things going on at the federal level. This may slip down this may slip down in level of importance for a while because right now because right now, frankly, Medicaid is in massive danger. And so there are other higher priorities at the moment. Okay. But Aaron, you're spot on. And yes, there are absolutely people at the federal level who are also trying to fight for that. Let's talk about the Healthy Indiana Plan, because that's not something we talk about at the ARC very often, but there are a lot of individuals, including individuals with disabilities, who are impacted by HIP. And excuse me, there are some changes that are going to go in place for HIP. First of all, HIP is what Indiana calls our Medicaid expansion program. Um, like I said, the plans to cap the number of people on HIP, we were able to get that defeated. Okay, so that is not going into effect, but the state is going to reintroduce work requirements for HIP. Those work requirements are going to require people on HIP to work, um, to either work, go to school, or volunteer for 20 hours a week. But there are also a lot of exceptions to that. So individuals who may not be disabled according to Social Security, but who have, health conditions, Indiana Medicaid can deem them what they call medically frail, and they would not have to follow those work requirements. One of the other really big exceptions is one that we got changed. So originally, the way the bill was written, they would have only given an exception to parents of dependent children. So parents who had kids under 18. we were able to get that expanded so that it's not just parents of kids under 18, it's the uh, parents of kids under 18 or caregivers, including caregivers of people with disabilities. So if we've got, somebody who's an adult with a disability and mom's still staying home with them to to help with their needs and everything, they won't have to face that 20-hour a week outside work requirement and can still have HIP. That was a change that we were able to get through, and I'm happy that we were able to do that. Okay. Um, One of the other things with HIP is that normally, if you had HIP, you had to make what are called power account contributions, which is where you would put money into a special account each month, and it would kind of act like a monthly deductible sort of a thing. Um, that got put on pause when the pandemic began. And before the state could start charging those power account contributions again, somebody filed a lawsuit against the state. And so there's currently what they call a federal injunction. That's where a judge says, hey, I am ordering you cannot require power account contributions right now while this case is going forward. And so, and they said that because they thought that there was a really good chance that the people who were suing the state would actually win their case. And so they said, nope, you can't take power account contributions until this case is over. So that is still going on. One of the other things to know is that HIP itself is also in danger. Maybe not as much as I would have thought, say, 2 months ago. But when Indiana created HIP, okay, because it is Medicaid expansion, 90% of the money for HIP actually comes from the federal government. And when they created HIP in state law, they put in a clause that says if funding for federal expansion ever drops below 90%, HIP will automatically go away. Earlier this year, I thought there was a really good chance that was going to happen. Um, I'm I'm thinking that's less likely to happen right now. Now, don't get me wrong. Is there still a good chance it could? It absolutely could. Okay. But I would say I've gone from 90% certain that it would go away to maybe more in the 60 to 70% range. Okay. So some things are getting a little bit better. But we've got some really uphill battles. There's also some things we need to troubleshoot, because right now we are seeing people have a ton of problems with their Medicaid. The first thing is that once a year, Medicaid does a redetermination. That's when you have to send in all of your financial documents and all of that, and Medicaid reviews them all to see if you still financially qualify for Medicaid health coverage. Right now, they're only allowed to do that once a year. But what they're doing are periodic reviews, or what I kind of call redetermination light, where basically they're sending people letters asking for all of their information. But if they don't get all of that information, people are getting kicked off of Medicaid. And the problem is people are not getting the letters from Medicaid asking for information. So they don't know that Medicaid's waiting for it, so they don't send it in. And as a result, Medicaid is terminating their services, they're kicking them off. And a lot of times people don't find out that there's an issue until they get a phone call from their doctor or they get a phone call from their provider saying, "Hey, your Medicaid's been terminated. We can't come out anymore." And so that's causing all sorts of problems. One of the things that we are recommending is Indiana Medicaid has what they call a benefits portal. And that is where you can set up an online account to go in and check on your Medicaid. You can do things like update your address or your phone number. You can print up what they call proof of eligibility, some things to say, yep, this person really is on Medicaid. Here's their Medicaid number. Um, But you can also check to see all of the letters that Medicaid has sent you in the last 6 months. You can find out if they are asking for information, you can find out what information they want, and you can also find out what information they already have. And so one of the things we are recommending is that people set up that benefits portal account. Um, the thing is you can only use one email address for one person. So so if you've got a couple of different people that you're trying to check on, each one of them have to have a separate email address for to be able to create that benefits account, that benefits portal account. But what we're recommending is once a month, like, when you pay your rent, remember to go into the benefits portal, and check on it. You're going to click, when you see your name, you'll also see, your case number. And that's going to be in that light blue color because, it's a link and you click on that. And then you can click on the link for notices or correspondence. And that way you can see every single letter Medicaid has sent you for the past 6 months. And so one of the things that we're recommending is that people go in once a month just to check to see, hey, did Medicaid send me any letters and I just haven't gotten them? Because there are a lot of problems with the post office right now, and people are not getting the letters that are being sent to them. And I don't want anybody to lose their Medicaid over a paperwork problem. So go in and check once a month to see, has Medicaid sent you anything? And the other nice thing about the benefits portal is you can upload information directly. So for example, one of the things Medicaid always wants is they want copies of your bank statements. Well, instead of having to take it into the Medicaid office, instead of having to mail it in, instead of having to fax it in, you can actually upload it directly through that benefits portal. And that way it does not get lost, which is one of those things that kind of commonly happens. Apparently, the Medicaid office is pretty magical, and paper can grow feet and walk away. So it's just a way to try to protect your benefits. The other big thing is if you get a notice telling you that you're going to lose your benefits or that you have lost your benefits, you need to appeal. The problem is there are certain timelines on when you can appeal. And the earlier you appeal, the better. You can still take some time to put your case together, but just giving them the written notice, sending an email, putting in writing, hey, I disagree with this decision and I want to appeal, that protects you. And if you submit that appeal, that request for an appeal, before your Medicaid is terminated, you get to keep your Medicaid and then keep your waiver while your appeal is going through. If your Medicaid has already ended before you submit that appeal, you're going to have to wait until the appeal is over before you can get your Medicaid and therefore your waiver back. So before I go on, what questions do you guys have? All right. You guys can always come off mute and ask questions in a little bit. So let's talk about some of the waiver changes because there are some waiver changes that are going into effect July 1st. The good news is for the family support and the CIH waivers, there are no changes to the service definitions or the services that are being offered. Okay. The big change with the family support and the CIH waivers is that they are going to have fewer new slots available for new people to start waivers. That's the biggest change at the moment. Now, if somebody is on a skilled nursing waiver, it used to be called the aged and disabled waiver. Now it's the health and wellness waiver or the pathways for aging waiver. We also have the traumatic brain injury waiver, which is a skilled nursing waiver. They've got some changes going on. And one of the biggest ones is that level of care assessment that they do to see if somebody is eligible for waiver services. They're actually changing the eligibility tool that they use, especially for children under 18. And instead of having to go to your local area agency on aging to do that initial evaluation, you actually will start going to a company called Maximus, and they will set up an appointment to do your level of care assessment, and they will get those results to you within 11 days. So they're trying to make this, they're trying to help speed things up because things have gotten a lot slower in the last year. They're trying to fix that issue. And by having a company who only does those level of care screenings, they're hoping to make the decisions more consistent and more understandable. This morning, the Division of Disability and Rehabilitative Services, that's called DARS for short, DARS had their advisory council meeting, and they do typically do that every month. But one of the things they were doing was sharing that later on in the year, likely in the winter, they are going to submit new amendment requests for the waivers to the Centers for Medicare and Medicaid Services. So people call that CMS for short, and that's essentially the feds. That's the federal agency who oversees our waivers. But they're talking about creating or submitting some new amendments to make some more changes to the waivers. Some of those include creating new services for people to be able to use. It includes changing existing services. It includes updates on what they call legally responsible individuals and who can be paid caregivers. They are also planning to expand self-directed care to the family support and the CIH waivers. That in and of itself is huge. They're also later in the year, they want to start using, or early next year, they want to start using a new eligibility tool for people to qualify for the family supports and the health and or the CIH waiver. And they announced several other things, and that's something that you would be able to watch probably within the next week or so if you'd like to learn more. You can also always talk with Sean Fulton, and he'd be able to give you a better idea of what all they talked about. So now let's talk about what's happening at the federal level, because that's where there is a lot of rumor and a lot of things that are constantly changing. And so the first thing I want to reassure everyone is that absolutely nothing is settled yet. Okay. Nothing has been fully decided yet. We're hearing a lot of things about what different people want to do, especially when it comes to Medicaid. None of that is set in stone right now. So a couple of months ago, the U.S. House of Representatives passed the Big Beautiful Bill. That is actually the bill's name, is the One Big Beautiful Bill. And it does several things. First of all, it will cut 880, that should say $billion, not $1 million, from Medicaid in the next 10 years. That's huge. That would be devastating, and it would be especially devastating for people with disabilities. They are going to delay efforts to simplify the enrollment and the renewal process for 10 years. They want to do more frequent redeterminations. They want to reintroduce work requirements and up to $35 co-pays for people on Medicaid. They want to, right now, when somebody applies for Medicaid, Medicaid will look back 3 months to see if you should have been eligible for Medicaid 3 months before you applied. That's called retroactive coverage. They want to reduce retroactive coverage from looking back 3 months to only looking back 1 month to see if you should have qualified for Medicaid. And then they are also looking at possible limits on how states can fund Medicaid. So that's what the House of Representatives did. But of course, if you remember your schoolhouse rock and remember how a bill becomes a law, you know that both the House, the U.S. House of Representatives, and the U.S. Senate both have to pass the same bill before it can become law. And then after they have voted on it, it goes to the president for his signature or veto. Well, the House passed their version. The Senate is now working on their version. And this is one of those things that has changed in the last 36 hours. So the Senate has confirmed that there will be changes from the House passed bill. So they're like, hey, House, we've looked at your bill. There are things we like about it. There's a massive things we don't like about it. So we're going to make some changes. What that means is if the Senate passes a bill that is different from the House's bill, it's got to go back to the House of Representatives. But there are a lot of rumors about what all is going to be in this. What we are hearing right now is that almost everything is on the table. You know, the Senate is open to a lot of different things. One of the things that they have said is that they have backed off this idea of doing block grants for states when it comes to Medicaid funding, or putting per capita limits on the number of people who can be on Medicaid. They've told us we don't want to do those things, but we're open to just about everything else. I say here nothing is in writing yet. That has changed. So three Senate committees have actually written their own bills for what they want this to look like. The Senate Agriculture Committee created a bill. The Senate Health Committee created a bill. But most importantly, what changed last night was the Senate Finance Committee submitted a bill. Senate Finance Bill is actually really important because that is going to be a blueprint for what the whole Senate bill will eventually look like. And so we've heard a few things about what's in it. We haven't been able to dig too deep yet. In some areas, they were saying, you know, no, we don't like what the House has, so we're not going to do some of those things. And in some areas, they were even stricter or had even deeper cuts than what the House did. So we're still trying to look through that and figure out what all the Senate Finance Bill has to say. But at the end of the day, it's what the full Senate bill is going to look like. And that has not been released yet. Okay. When it is, again, both houses, so the House of Representatives and the US Senate, both have to pass the same bill. So if the Senate passes a bill and it's not the same as the House's bill, the House has to vote on it. And then if it's different from what the Senate passed, it goes back to the Senate for them to vote on it. And so what we may see is where the bill could ping pong back and forth between the two houses, which would delay when that bill gets passed. So what can you guys do? Well, a whole lot. And the biggest thing you can do is you can share your story. We did that with the Indiana General Assembly, where we collected people's Medicaid stories, talking about how Medicaid was important in their life, what all Medicaid actually did in their life, because believe it or not, legislators really actually don't know those answers. They typically only think about Medicaid as being health insurance for people, for poor people. And they don't realize all the different things Medicaid does. They certainly don't realize that Medicaid is what pays for waiver services, and those waiver services are what help people with disabilities live their lives. So those Medicaid stories really humanize Medicaid. And it made a huge difference with the state legislators, because we could go to those legislators and say, hey, here's a video from a person in your district. Why don't you hear from them what Medicaid means to them? Or we could share, the written stories that people submitted and say, hey, this is a person in your district who's affected by all this. Why don't you listen to what they have to say? And so that's what we did at the Indiana level, and it made a huge difference. That's a big part of how we were able to stop a lot of the most significant cuts from going into effect, and how we were able to save a lot of parts of Indiana Medicaid. And the Arc of the United States is now doing the same thing for Congress. And so they're going to use the stories that people with disabilities, that self-advocates submitted about the role of Medicaid in their lives. They are also trying to collect stories from people who are in Medicaid expansion. So in Indiana, people who are on HIP, to explain what HIP means to their life, how it helps them live their life, how it helps them, so that they can be healthy enough that they can work and make money to pay their bills and to be able to afford to live. And so the Arc of the United States is collecting stories, and especially stories on Medicaid expansion. I would have put the link in the presentation, except the fact that the link is really, really, really long. So you can get to it from the Arc of the United States website, which is just thearc.org. And if you're having trouble finding it, you are welcome to email me. You're welcome to email Becky or Sean or Aaron, and we can get that link and that information to you. The other big thing you can do is contact your members of Congress. You'd be amazed that a lot of members of Congress think that there isn't anyone in their district on Medicaid, or very few people in their district on Medicaid. They would be shocked to learn that most people on Medicaid actually work. And a lot of self-advocates do work. And so they need to hear some of those things. They need to hear what Medicaid and what waivers actually do to help you live your life and have the life that everybody else gets to have. So let me open it up now and ask, what questions do you guys have? Go ahead and pull yourself off of mute and ask anything you have. I will give you the most accurate answer I can, knowing that all of this could be different an hour from now. What questions do you have?
I have one.
Sure.
With being on that, how do you work full time if you want to work full time?
You know what? Working full time gets a little bit tricky. With Medicaid, it's a little bit easier because we do have MedWorks. And we've got two different types of MedWorks. We have regular MedWorks, and then we have what's called MedWorks Improved. MedWorks Improved was designed for somebody who worked off of Social Security benefits, but they still have a disability and they're still trying to work. If you are a single adult, literally meaning you're not married, this year on MedWorks, you could earn $4,564 a month from all sources. So your Social Security and any work you do, and still have full Medicaid. That's just under $55,000 a year. And, with MedWorks, you do pay a premium based on your income. But the maximum premium for a single adult is $187 a month. And that's if you're making 55 grand. So it's certainly something that's affordable. So when we're talking about how can you work, and work full time, if you're worried about your Medicaid and your Medicaid waiver, that's how you protect those, is by going on MedWorks. If you're talking about protecting your Social Security, that's where it gets a little more complicated, because there's no set answer. There's no answer that applies to everybody. The answer for each person is individualized. It varies by who you're talking to, because with Social Security, they're looking to see, can you make $1,620 per month in countable income? Well, first of all, that word countable needs a big neon flashing asterisk next to it, because Social Security takes a lot of different things into consideration to reduce how much of your income they're counting to let you work more. And so that answer is going to be based on your specific situation. Okay. I promise I'm not trying to punt that answer, but it's a matter of, I can't give a universal answer to that one. And so one thing you can do is you can talk to what's called a BIN officer. Or if you, if you work with a provider agency, if they have anyone who has been trained, you can ask to talk with them about all of this, so that you can figure out, how can you work while protecting your benefits all at the same time. because it is possible. You just got to have somebody, help you document all of that. That's a really, really great question, Katie. Thank you for asking it.
Okay. Also, when you have time,
Uh-huh.
can you send me the topic that we're talking about?
I sure can. Well, what I'll do is I will get it to Becky and Noah and Sean, and I'll have them get it to you. Okay.
Thank you.
Sure. What other questions do you guys have? Because the reality is, I know this stuff is confusing, and right now it's changing so much. It's hard to keep track of. It's hard to figure out, what is going on day to day. You could ask Sean and Mel. They see me in the office all the time, and they know I'm kind of losing my mind over it. So, you know. Any other questions?
I
Aaron?
guess what I'm sort of concerned about is
Uh-huh.
um if a person gets cut from Medicaid,
Yeah.
do they lose the waiver as well?
Yes. You must have you must have Medicaid health insurance in order to have a waiver. So yes, if you lose your Medicaid, you absolutely lose your waiver.
So say if somebody loses their waiver, what's the alternative route would you suggest for that person that loses a waiver for like insurance? Because they couldn't go reapply, could
Well,
they?
they can.
Okay.
I think and thank you for asking this because yeah, this is information we need. I think the first thing I would do is, if you are in danger of losing your Medicaid or you found out after the fact that you have lost your Medicaid, you still appeal. Okay. If you need to, you can reapply for your Medicaid. It'll take some time to get all sorted out, but you can do that. But I would absolutely appeal if you still can. So what happens if you truly lose your eligibility? Well, and because there will be people who do. The Congressional Budget Office estimates that as many as 17 million people will lose their health insurance, their health coverage over all of this. Um, what that'll really look like, we don't know because it's going to be very dependent on the details. But yeah, the danger here is that a lot of people will lose their health insurance, and then they'll get sick, you know. Um, an option people have is the Affordable Care Act marketplace. Um, people will also call it the Obamacare marketplace. That is another way that people can get health insurance that might be a little more affordable. One of the problems is as they're cutting Medicaid, they're also trying to cut the premium subsidies that people could use to pay for a marketplace plan. So that's not going to fix it for everybody. But that's one of the big concerns. Um, and normally to change health insurance, you can only do that during what's called open enrollment. That's normally at the end of the year. But if you lose your health insurance, that is what's called a qualifying event to let you change your health insurance. So that's one of those times where there's an exception to the normal rule, so that you can try to get on other health insurance. The problem is a lot of people wouldn't necessarily be able to afford health insurance, and that's where trying to use a free clinic or something like that is really their only option. Um, Oftentimes, not every place has a free clinic, not every place has that ability. And oftentimes, they are kind of overwhelmed by the number of people who need them. So it's an alternative. It's not a great alternative. Um, and so that's one of the other options people would have too.
So say for instance, if the person loses the Medicaid, but
Right.
they go through they're fighting for an appeal, but then they get a letter from the person saying, okay, well, we're going to take away your waiver,
Oh,
but
wow.
you're trying to explain to them, well, I'm fighting for an appeal.
Right.
So, but they go ahead and take away the services.
Well, if you are appealing and if you got your appeal in before your Medicaid ended,
Okay.
your Medicaid and your waivers stay in place while you are appealing. Okay.
Okay.
It's a matter of if your Medicaid has totally ended before you appeal, then you've got to kind of wait to get it back. With the waiver, you have what's called a waiver slot, and that slot is yours for 1 full year. And so
Okay.
because sometimes people do, have problems with their Medicaid, or maybe they go in and out of the hospital or some things like that. That's why that waiver slot is yours for an entire year. If during your waiver year, that's when your Medicaid gets terminated, that waiver is still waiting for you to get it so that you can be able to fix it. Okay.
Okay.
So
Okay.
not everything is lost if that happens. And frankly, if that happens, what I really want you to do is I want you to call us here at the ARC. I want you to talk to one of our family advocates so that we can help you with this, because this is something we help people with all of the time. And every one of us who works for the Advocacy Network is either a parent, a self-advocate, or a sibling. So we all live this life too. And so we know how to help you through all of those things. So you do not have to do any of this alone. You've got partners here at the ARC who will gladly help.
Okay. Sorry for all the questions.
No, I'm grateful you're asking the questions because, like I said, this stuff is confusing on the best days. These aren't the best days right now. And there's so much changing, and there's so much changing on a regular basis that it's really hard to keep up with. So
So if you exceed over that year, then you would have to reapply for the waiver,
you
right?
would, you
Okay.
would.
Okay.
So, so yeah.
Okay.
What
Thank
other,
you.
sure. What other questions do you guys have? Yeah, Katie?
Uh, um, I mean, my mom is always like on talking to them, but I'm never really on the call with her.
Okay.
But when she acts like, I mean, they can talk like for hours or whatever.
Yeah, and sometimes you're on hold for hours.
Yeah.
Yeah. One of the things you can ask your mom is, hey, when they actually answer, can you put it on speaker so I can hear and I can learn about this stuff? I kind of ask her that way, and then kind of try to have a conversation afterwards about it. So that you're learning how all of this works. So that, if there become problems later on, you know what to do too.
But I always have to be here with
Okay.
her
Okay.
so they can, so I can give them permission to talk to my mom.
Okay. Yeah. My son has to do that with Social Security. Now with Medicaid, I'm an authorized representative, so I don't have to do that with Medicaid, but for Social Security, I do. So I understand that part. Yeah, no, just one of the things I would do is I would ask your mom if she can put it on speaker so that you can hear it, so that you know what's going on. Is that what you're wanting, or do you not want to have to do any of that?
What eventually I would like to learn how to do
Okay.
it.
Okay. Then that's how you do it is say, hey, can you go on speaker so I can hear and I can start learning? Okay. And I'd have that conversation with her.
Hey, Carly, Aaron had to go because the tornado sirens were going off in
I
Lafayette.
saw that. I saw that. So, all right. Um, well, we are I think we're at time, aren't we? It's 3 o'clock? Okay. So here's the other thing. If you guys, think of a new question like 3 weeks from now, or if you hear something on the news and you want to know how it impacts all of this, go ahead and reach out to SAI, whether that's Noah, whether that's Becky, whether that's Sean, whether that's Melody, whether it's Aaron. Go ahead and reach out to them, they'll talk to me. They'll talk with Tom Krishon, who's our chief legal officer, to be able to give you an idea of what's really going on. One of the other things is normally we send out a legislative memo by email once a week during the Indiana legislative session. With everything going on at the federal level, we've decided that this year we're going to keep sending that legislative memo out. But we're going to do it every other week instead. And so if you do not already get that, I'd highly recommend that you sign up for that. That way you can stay up to date with all of the things going on, and you're informed about the latest, you're getting all of the latest information, and it's information you can trust because it's coming from the ARC, and you can trust the information that's coming from the ARC. We're gonna tell you what's really going on. We're gonna update as needed. And we're going to make sure you really have a good idea of what's happening. So consider signing up for the legislative memo too. Okay. Is there anything else anybody would like to talk about before we finish for the day? I think Ashley might be trying to come off mute.
Yeah, if I did have Medicaid, I would not be having my surgery on Monday.
You're having surgery
So
today. Good
yeah,
luck with everything, my dear.
yeah, I'm having surgery on my right ear on Monday.
Okay.
If I did have Medicaid right now, I would not be having the surgery.
Okay.
So this is like a really critical time
Right.
for me right now. So
Sure.
yeah.
Okay. All right. All right. Good luck with everything on Monday, Ashley.
Thanks.
Yeah, good luck.
Okay. All right. I want to wish Mel a happy birthday. Mel's birthday is on Friday, and so I must say happy birthday to her.
Thank you. Thank you, guys. Thank you so much.
All right. Well, ladies and gentlemen, thank you so much for joining us today. Again, if you have any questions, reach out to Noah or Becky, Sean or Mel, and we will gladly get you some answers. Have a wonderful day, everyone.
Yeah,
Bye-bye.
thanks, guys.